Welcome back to the show. Many thanks for staying with us. Now, the WHO says it is concerned about the preparedness of many African countries to conduct a successful COVID-19 vaccination once a vaccine is made available for Africa next year. Lack of logistics and supply chain systems in many African countries could delay the distribution of vaccines to some countries. As the WHO says, average preparedness for the continent is disappointingly at 36%, as against the 80% required. Dr. Richard Mihigo is WHO's Program Area Manager, Immunization and Vaccine Development, and has been addressing a news conference.
The key areas that are currently needed some attention are mainly the logistics and supply chain, and here specifically the need to review the vaccine distribution strategy, mapping the points of storage, and additional backup storage facilities. As we know, we might not have enough capacity to store all the vaccine, and this should include the private sector, such as the food and beverage industry, to improve vaccine safety, to identify any adverse events following immunization, to improve demand generation, including ensuring that we listen to community concerns via social media and other platforms while managing rumors. Community have played, as we know, an incredibly important and central role in stopping the spread of COVID-19, and they will be central to the rollout of vaccine against COVID-19. So it's critical that authorities reach out to communities to listen to their concern and give people a voice in the process of developing and implementing delivery strategies. It is also critical to fight anti-vaccine information. Some of the vaccine that have received, or for which we have seen some efficacy data, will require ultra-cold requirement, or minus 70 or 80 degrees. But even if it is a stable vaccine that could be stored at the regular temperature with normal cold chain condition, we need to work on the readiness to execute delivery strategy effectively. This will be, without any doubt, the biggest vaccination campaign in our history. So the planning and resources made available need to reflect the scale and the scope of this mammoth task. Prioritization is a key component of the delivery strategy, and we can learn from approaches in countries where vaccination is underway. Countries like Canada, the UK, or even the US are mainly targeting frontline health workers. So we are working really with the African countries to prepare for the regulatory approvals for the vaccine, as well as defining delivery strategies and the needed infrastructure, determining priority groups, identifying source of financing, and advocating globally for the equitable distribution of vaccine supply. So I'll be happy in collaboration with my colleagues to respond to any question that may arise during this conversation. Thank you, Dr. Tuwebwe.
Thank you.
As a WHO press conference, now the WHO also plans to roll out its biggest immunization campaign yet, distributing more than 2 billion vaccines to African countries by the end of 2021.
Many countries in our continent are continuing to report on their progress using the Vaccine Introduction Readiness Assessment Tool, or what we call familiarly VIRAT, which is a tool that has been developed by WHO and UNICEF, and more recently merged with the information from the World Bank. And so far, 45 countries on the African continent have reported some data in that readiness tool. And the average readiness across the region is unfortunately only at 36%. This is really far below the desired benchmark of 80% to conduct a successful and efficient vaccination drive.